Hi everyone, my name is Dr. Marwa Kaisey. I'm a board certified neurologist and I have seen thousands of patients in the clinic, both in person and on video. And today I'm going to tell you how to properly prepare for your visit with your neurologist to make sure it's as successful as possible. So if it's a new visit, make sure you know where the office is, where the parking is, and if there are any forms that you need to fill out ahead of time, fill those out at home, take them with you. It'll save you some time there. Take a form of ID and proof of insurance and arrive early. Give yourself at least a 15-minute buffer for any trouble parking, any traffic, and the check-in process, which can take some time, especially if you arrive during a busy time in the clinic. If it's any other visit or even in the new visit, definitely take someone with you if you can. So if it's virtual, have someone with you. If it's in person, take someone with you. 2 brains are better than 1. At least one of you should be taking notes if possible. It's just sometimes can be overwhelming, especially if you're getting a new diagnosis or switching to a new medication. And like even me, sometimes I can't remember exactly what my doctor said, and it's just nice to have somebody else there. Dress appropriately, and that really means for a neurology visit, loose, comfortable clothing. We will sometimes want to examine your upper arm, your thigh, so make sure if you're wearing pants that they can be rolled up easily and they're not too tight. And then wear shoes that you can walk in. I have one patient that comes in like 5-inch heels to every visit, and more power to her because I can get a really good gait exam and give her bonus points for that. But the neurologist is not only going to have you walk sometimes, but have you do different types of walks, like walking on your tiptoes, on your heels, doing a tightrope walk. So make sure that you're wearing shoes that are comfortable enough for you to do that. This counts for video too. Wear pants even if it's a video visit, okay? I know a lot of us got used to working from home and only dressing from here up. Full disclosure, I have sweatpants on right now, but if you're doing a video visit with your neurologist, they may want you to get up and walk even though you're not right there in front of them. And I've had this happen a few times with my patients where I say, okay, let's get to your gait exam, let's see you walk. And you know, they laugh and they have to turn the video off for a second to put some pants on. So don't let that be you. On the same token, in video visits, try not to be too distracted. So, you know, try to keep the dogs and the kids, I just love seeing them when they hop on video with my patients, but sometimes the patient themselves is distracted. So more for your sake, try to keep those distractions at bay if you can. Don't be eating. I once had a patient finish a full 6-inch sub and a can of Coke while we were doing our visit. And, you know, I got a good exam in that way, and that I could tell that her swallowing wasn't impaired, but I don't know if she was really able to focus on both things at the same time. And it was a little distracting for me to watch somebody eat the entire time that we were talking. So no eating, not usually something that most people need to be told about a doctor's visit. Take a list of your symptoms, a list of your medications, and most importantly, a list of your questions. So we all do this. We go to the doctor, we ask them a couple of questions, then forget 1 to 5 other questions that we have that we don't remember until we get back to our car. So don't let that be you. Take a list of questions and a way to be able to kind of take notes next to those questions if you can as you're asking the doctor. And let the doctor know about those questions towards the start of the visit. The worst thing is when, you know, we use up all the time we have and we think we're good, and then as we're leaving, the patient's like, oh, but I have this list of 5 questions that I wanted to ask you. And then we're either not able to give those questions the full amount of time and energy to answer them properly, or we keep the next person waiting for a long time because we get backed up. So let the doctor know towards the first half of the visit that you have some questions that you'd like to ask him or her during that visit. Also take a list of any results that weren't done at that hospital. So for example, I'm at Cedars-Sinai, but some patients will have their MRIs done at another MRI facility in LA, or their labs done at an outside lab. Make sure that either your doctor's office has those before your visit or you take them with you. And this includes EEG results or EMG, nerve conduction study results, basically any test that you have that neurologist wanted but you didn't have done within their hospital. Either call ahead and make sure the clinic has those results, or just hand carry them with you to the appointment. Sometimes, this is myself included, we want to see the actual pictures. So a picture is worth 1,000 words, in my opinion, for the MRI. And so I will want to see the actual pictures. And despite it being 2021, somehow most places have not figured out a system to do this other than sending a CD-ROM with you home, or mailing it to us, or mailing it to you. Now, we have a system where we can have somebody upload their images from a CD-ROM at home to our system, but I don't have a CD-ROM drive at home. I don't know a lot of people who do. So if that's the case, either mail the CDs to your doctor's office or have them, have the radiology center that did the MRIs give you a CD before you leave, have them burn it for you before you leave, take it with you, and then take it with you to your neurologist's office too, so they can actually see the picture that the radiologist is summarizing in their report. Finally, before you leave, try to understand when the next visit should be. So the neurologist will tell you, oh, I want to see you in a month, I want to see you in 6 months, whatever it is. Understand when they want you to come back. And if you're there in person, try to actually schedule the visit with the schedulers or the checkout folks before you leave that office. Neurologists are very busier. We're only getting more and more busy as there's a big neurology shortage. And so it's best for you to try to get on their schedule as far ahead of time as possible. And this is something you can often do before you leave the office that day. So I hope this helps, and I hope you have a great experience with your next neurology visit.